Hi everyone, welcome back to our podcast called The Research Behind Lift the Lid, where we talk to researchers previously funded by Australian Rotary Health about their research findings. I'm Jessica Cooper, and on episode 18, for the first time, we'll have two guests today, welcoming back Dr. Laura Hart from the University of Melbourne, as well as Dr. Claire Kelly from Mental Health First Aid Australia. Dr. Hart was awarded a mental health research grant from 2014 to 2016 for the project Teen Mental Health First Aid Training, a pilot cluster randomised controlled trial. On her research team was Dr. Kelly, along with Professor Tony Jorm and Betty Kitchener. So thank you very much, Laura and Claire, for joining us on our podcast today. How have you both been going at the moment?
Hi Jessica, great to be here. Thanks for having me on again. I'm in Melbourne, so I'm still in stage 4 lockdown, so I haven't been leaving the house much, but I'm well, thank you.
That's good to know.
Yes.
What about you, Claire?
Same. I'm here with my furry housemates, the little pair of cats who are, making sure that I keep working hard. But yes, it's 2020 has been a very challenging year, which I think makes a lot of this even more important.
Yeah, absolutely. Well, it's good to have those furry colleagues, keeping you on track. Well, I'm very excited to talk to you both about this program and the research behind it, because it's definitely received a lot of attention across the world, especially with Lady Gaga taking it on board. Did you expect the Teen Mental Health First Aid program to become so big?
Well, it's a great question. Mental Health First Aid is a really impactful program that's spread to more than 25 countries across the world since Tony Jorm and Betty Kitchener started it here in Australia in the year 2000. So we knew when we created this program that there was the capacity for teen mental health first aid to be spread internationally. And we wanted to try and make really positive impacts for young people who are at high school. So the Teen Mental Health First Aid program is designed for young people in high school to teach them about how to help their friends who might be developing a mental health problem or experiencing a mental health crisis. But to have someone so influential as Lady Gaga to really champion the program and talk about its value for young people in protecting mental health has just been an absolute dream, and it wasn't something that we expected, but we're just so grateful for the amount of reach and influence that she has, and to be able to be talking about this program and making sure that it gets into as many schools as possible is really fantastic.
Yeah, absolutely. I know that's, something that everyone is, just like, wow, Lady Gaga is, putting that program out there to schools in the US. So, that's very exciting.
I think as well, the fact that she not only put money into it and not only stood up and said this is an important program, but that she was there on the ground. She involved kids in a concert when they were amongst the first to be trained, and she spoke openly about her own experiences with PTSD as well.
Mm-hmm. Yeah, it's so positive having that kind of role model, for young kids.
Yeah, absolutely.
Yeah. So I guess before this project started, Mental Health First Aid was very well known and popular on its own. Who was it who came up with the idea to bring the program to teenagers?
I think I'll just take the credit for that. Look, really, I think it's certainly something that I had been interested in doing right from the time that I started my PhD, when Mental Health First Aid was still a small program. When I did some focus groups and realised how much kids had appreciated the opportunity to talk in small groups about mental health. But that was a really long time ago, and a lot of research ago as well. I think the really important part of the journey there is that right from the beginning of Mental Health First Aid, people were saying we need a version of this that can go into high schools, that's got specific information about kids in this age. And then as soon as we launched that program in 2007, people said, oh, great, okay, now we need to know what the kids can do for each other. So I think that it was just part of a really natural progression, and one that people just embraced wholeheartedly. And Laura was heavily, you were the responsible researcher on the original guidelines, weren't you? Yeah, absolutely, which really created a roadmap forward for us. And I think one of the important things was that it demonstrated that we could tell people that it was safe to talk about suicide with young people, which I think was what a lot of people were afraid of. That keeping it a taboo subject wasn't helping, that's for sure. So, I'd say that it was a group effort, but I'm still happy to take all the credit.
Yeah. Yeah, well, it's a very important program, and certainly it can be very useful for teenagers who might not know what to do in that situation. So it's some great work. And I know that you received the grant in 2014. I guess at the time when you were doing that research, what findings came out of that project?
We're actually still continuing to analyse our really rich data set from this trial, and we've still got findings that are coming to light. But essentially we found that when we compared our 3 teen mental health first aid sessions, so in high schools the students are presented with a 75-minute session once a week for 3 weeks by an externally trained and accredited mental health first aid instructor. And we compared this to students who received a matched physical first aid program. So it's also 3 sessions of 75 minutes, and they learn about strains and sprains and how to do CPR. And so when we compare these 2 programs, we found that those who received teen mental health first aid showed dramatic increases in their confidence helping a friend with a mental health problem. They had decreased stigmatising attitudes towards people with mental illness. They had improved attitudes towards seeking help from adults. So we saw some of those barriers to seeking help really come down. And we even saw increased skills in preventing suicide in friends. So lots of really positive outcomes from that trial.
Yeah. Oh, well, that's great to see. And I guess now, after the research that you've done, how far does the program reach, and what sort of benefits can teenagers get out of the program if they do it now?
The reach has been pretty extraordinary. It's really hard for us to quantify it, but certainly we would be approaching about 100,000 students across Australia having done the program now, and that's just Australia, of course. So it has spread quite a long way, and it will continue to spread. We always see an overall increase in the number of people picking up the program. Plus, I think, really importantly, because of the events of 2020, between the bushfires and the pandemic, I think there's a real recognition in schools and at the department level, and really anyone who has concerns about adolescence is especially concerned this year for that reason. So I anticipate that we'll have an additional growth period next year. But in terms of the benefits, they're enormous. I think one of the things that we knew from the outset, particularly from the research that we were doing before the program was actually developed, and also from some of our piloting, was that kids actually had quite good mental health literacy, as in knowledge about mental health. There are great programs in Australia that have helped them to learn about things like the symptoms of depression. But what they lacked was the skills to support someone, and they knew that themselves. They were saying, I'm afraid that if I say something, I'll make it worse. They carried a lot of the same sorts of misinformation that other community members have, because obviously they learn that from the broader community, that it's not okay to talk about certain things. So, and I think that above all of that is the fact that kids love their friends, they care about their friends. And when they know that something's wrong and they don't have the skills to help, that's a really frightening place to be in. So the key thing is really giving them the tools to start those conversations, and the confidence to know that they are not going to make things worse, that they're actually giving someone the opportunity to talk about how they feel.
Yeah.
The mental health first aid program is unique, and it provides a number of benefits over other mental health programs that are provided in schools. So like Claire touched on, a lot of programs are wonderful and increase mental health literacy, but they often focus on only one disorder, like depression or like anxiety or like suicide prevention. A lot of school programs also screen for people who are at risk of like they're showing symptoms and then they're at risk of developing a disorder. And only if you're at risk do you get a program that then helps you to sort of reduce those risk factors. And one of the benefits of mental health first aid is that it's a whole of school community approach. So we don't just go in there and train a select group of teenagers in how to help their friends, because we know from mental health prevention and suicide prevention that you often don't select the right people, and that people who are distressed will fall through the cracks because they don't necessarily want to reach out to the people who have been trained. And we know that only providing gatekeeper training to teachers isn't enough, because young people want to talk to their friends first and foremost about how their mental health is going. So the approach of mental health first aid has always been as big as possible, as many people as possible. So when we go into a school, we teach youth mental health first aid to parents, we teach youth mental health first aid to teachers, and we take a whole year level approach. So every student in years 10 through to year 12 can be trained and should be trained. And the more people who are on message with the action plan and the language, the more stigma reduction we see, the better effects in suicide prevention you would be likely to see, that the more cultural shift in the way we talk about mental health. And because it's a universal program, the skills that we teach are the same whether someone's experiencing an eating disorder or someone's experiencing depression, someone's experiencing substance misuse, or they're thinking about suicide. So we don't focus on any one particular disorder, and we go big. We want to make sure that everyone in the school community is on the same message. And I think that that approach, that sort of population or whole of community approach, is a real benefit.
Yeah, that's so important, especially since, nearly 1 in 2 people experience a mental health problem in their life. So, you always know someone who's experienced some kind of mental health problem. So having those skills, especially early on, it's so important. So yeah, it's some really important work. I know that it's obviously expanded really far already. I guess, have there been some other implications, or are there any plans for further research or tweaking the program as it is at the moment?
So this research gave us the really important data that we needed to show that the program was effective and safe. But in order to get that sort of big impact that I was talking about, you really need to do a really large scale trial. And the only place with enough funding to do that kind of research is the National Health and Medical Research Council, or the MHFA. But they're really, really competitive, and you've got to be able to show that the program is worth investing in before you can apply to them. So the money from Australian Rotary Health to complete the 2014 to 2017 program allowed us to show that, yep, this is a positive program, we don't see any adverse effects. And so we were able to apply to NHMRC. And in 2017, we were awarded a $1.3 million grant over 5 years to compare this program, again, teen mental health first aid to Red Cross physical first aid, in 10 schools. So this has 3,500 students. It's a really big trial, and we're now in year 4 of this study, so we finish next year. So the funding from Australian Rotary Health was absolutely essential in allowing us to take that next really big step to look at, on the big stage, how does this work, and are we seeing the same positive outcomes again? And I'd also like to say that the other part that we're doing in terms of tweaking is that Mental Health First Aid Australia are working on updating the materials to keep them relevant for teens in schools now. So we know that young people 10 years ago and what they liked and their aesthetic is not the same as young people now. And so we do need to keep the materials fresh and making sure it speaks to young people. So Claire has engaged more young people with lived experience of mental illness to provide artworks and to engage in trying to develop the materials to make sure that they're appropriate for youth. And we're also speaking with national and state governments about the need to implement this program across Australia in schools to help meet the mental health demands, which are just going to be unfortunately astronomical due to COVID-19 pandemic pandemic and the economic recession. So there's lots of work going on in this space at the moment that's really been launched by that initial funding that we got.
Yeah, it sounds really exciting, such a big grant that you've received, as a result of the initial funding, doing that pilot study. So yeah, it'd be good to see, how it grows and goes to different schools. So yeah, that's amazing. And I know, Claire, that you currently work at Mental Health First Aid Australia. Could you maybe tell us a bit about your role there and what you've been doing?
Sure. Look, I'm the Director of Research and Curriculum, so I have responsibilities over all of the curriculum and all of the programs all the courses that we run, as well as a supervisory role in the research program. So, but I have my fingers in a lot of different pies.
Yes.
I think I would very much like to clone myself at some stage, because I also do the mentoring of our new international partners, including right this week as we speak. I'm actually working with a new international partner who's taking on the teen program, and they saw the first session of that last night and they were beyond excited. And Laura, how many times have we heard these words? I wish this existed when I was in high school.
Yeah. Absolutely.
The program and the teen program, there's just this recognition, I think, that a lot of people have when they start to see these materials, that, oh my gosh, so I wasn't a whiny teenager. I wasn't just a normal moody brat. I was struggling, and there just weren't people around who actually recognised that. And I think that's incredibly important.
Yeah, I think definitely. It would have been great to see something like that when I was in high school as well, because you always know people who are going through things like that, and at such a young age you don't know how to deal with it. And it's just such a great thing that you're doing, and I'm really glad that it's out there now. It's just it's amazing.
Yeah, I think there have been a lot of programs over the years that have focused on help seeking, on individual people recognising that they need help and looking for it. But I think one of the problems with that when it comes to mental health is that often, because of the symptoms of mental health, you may not recognise that you're not well. You may feel as if you don't deserve that kind of help. You might feel that, well, this is just, it's just normal to be unhappy in a world that is this horrible. And so empowering other people to offer that help and help you to actually take the steps of, hey, let's go and talk to the school counsellor together, or, have you tried talking to your mum about the way you've been feeling, makes an enormous difference.
Yeah, absolutely. So I guess, from what we've seen already, that there's been a lot of good that's come out of this research and the Teen Mental Health First Aid program. It's helping real teenagers across the world learn how to help their friends with mental health problems. I guess we'd like to hear your views on why research behind these kind of programs is so important.
I think first and foremost, speaking about suicide prevention in schools can be risky. So we know that the way media and TV shows can depict suicide or talk about suicide can either glorify it and make people more at risk, or they can really stigmatise it and drive the problem underground so people don't want to talk about it. And neither of those approaches in schools are appropriate. So the way you talk about suicide is really important, and evaluation of whether or not it's safe and effective is just absolutely crucial to make sure you're not doing any harm. So the most effective suicide prevention method we've ever discovered is simply asking someone, are you thinking about suicide? And then very carefully listening to their answer without judging them. That's the most effective thing we can do. But communicating those skills and how you do that requires a whole heap of scaffolding and education and getting people confident enough with the skills and with our action plan so that they can do that without feeling like they're going to make it worse, and that they know what to do if the person that they've asked says, well, actually, yes, I have been thinking about doing that. It's like, okay, I know what to do now. I need to make sure I don't leave the person and get someone involved, get an adult involved, get a professional involved. So we can safely talk about suicide in schools. It's such an important message. Like, we don't want to drive this underground. We don't want schools to think that, oh, we can't touch this, it's way too risky. We can do it, but it has to be done safely. And that's why evaluation research is so incredibly important in this space. it's essential to discovering whether or not the program does what it intends to do and does it safely. And I think now teen mental health first aid is probably the program in Australia that has the most evidence to show that it's safe and effective. There's other suicide and mental health literacy programs around the world that have a similar level of evidence but haven't been trialled here in Australia to the same degree yet. So I think it's a wonderful opportunity that Australian Rotary Health has given us to be able to develop the data to show that it is a safe program and that we can be really confident in rolling it out across Australia, especially in these post-pandemic or during this pandemic time when mental health needs are really increasing.
Yeah, absolutely. And I'm sure it'll be very helpful for teenagers, going through the aftermath of COVID-19 and, trying to, work out, how that affects them and dealing with that. So, yeah, no, it's been great. I guess this is also a great example of why Rotarians and the wider public should, maybe consider donating to mental health research. I guess as well, could you tell us a bit about the impact their donations may have had for this project?
Can I take this one, Laura? I feel like I'm honour bound to take this question because I actually come from a Rotary family as well. I think that I spoke to a Rotary club for the first time when I was about 13. So to me, it's been amazing to actually watch how because Rotary always did amazing things for health research and also for providing medical support for people all over the world. I mean, polio and mosquito nets and just so many things. But when they picked up mental health, I think that there was just it felt different. You could see that the clubs had recognised that there was something here that they could do that was going to have a profound impact on the entire country, on our entire community. And also that because of the reputation of Rotarians, that they're down to earth, that they're out there in the community, that they are business owners, that they are workers, they are real people. It meant that the work that was done to start improving the profile of mental health was supported at the very grassroots by Rotarians. So there was so much going on. There was the work that Rotarians were doing on the ground, and there was the fundraising, and there was something that actually I think, Laura really hit the nail on the head talking about how Rotary took a chance on this program. That's not the first time that they've done that for mental health first aid. In fact, our guidelines project started when we hadn't been successful in getting funding from more traditional sources, but Rotary looked at it and said, this is a good project that's going to have an impact on the community really quickly. Go for it. And that funded actually my postdoctoral research actually for 3 years. And again, it meant that we could then show the results and people would say, okay, I'm prepared to fund that. So Rotary has had a profound impact, and it's really, I don't know, sometimes I think about the work that we've done, particularly the Rotary funded work. And I think about Sunday mornings when I was a kid helping to set up a trash and treasure market in a supermarket parking lot at 6 o'clock in the morning and complaining that I'd really rather be at home. And now I'm actually immensely proud to have been a part of something that has made such an enormous impact, and that I can really point at all the moving parts of that. It's amazing.
I think too that the Rotary and the clubs and all their fundraising do have this incredible global impact, and the spread of mental health first aid is one of the success stories. But I think from a personal level, it's changed lives as well, especially lives of researchers. So as a female with young kids and lived experience of mental illness, it's incredibly difficult to work in the academic space and apply for research funding. We're very disadvantaged in the mental health sphere because medical research is often geared towards cancer prevention and heart disease and a whole range of other really important illnesses. And so to have a space like what Australian Rotary Health creates to apply for funding and put that on your CV as a young researcher, that's just an incredible leg up into the world of research, and without that kind of stepping stone, it would really, disadvantage our careers incredibly. So I think it's true to focus on that massive global impact and the population mental health impact, which has been phenomenal. But I think, like Claire talking about her PhD funded research, I received, thankfully, PhD funding from Rotary as well. It really changes researchers' lives for the better as well.
Oh, well, that's so good to hear, and it's always amazing to hear about the results that come from those donations. So I'm sure, Rotarians, love to see where their donations have gone, and mental health first aid and teen mental health first aid it's a great example. So I thank you both for coming on and talking to me today on our podcast. I guess before we wrap up, is there anything else that you want to add?
I just want them to know that the donations that they make and the research that gets funded, it has a ripple effect. It's not just the cash amount that gets donated. It's the Rotary name behind it. It is the way that Rotary funded research is viewed by the broader community. I just want to say thanks to all Rotarians who are, getting out in cold weather and hot weather and doing their fundraising. Everyone has been able to reach into their pocket and make a donation. Just thank you. Thank you so much.
I second that. Thank you so much. It really is life-changing.
Thank you both so much again. It's been great. And that was the 18th episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health and how they are helping us on our mission to lift the lid on mental illness. If you can, please continue supporting important mental health research like Laura's and Claire's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.